Refresh Bolivia is an entirely student-run nonprofit that serves the underprivileged communities of Cochabamba, Bolivia. This is Sandra. She's 33 years old, she has 3 kids, and her household income is $10 per day. This is her son, Luis. He's 4 years old. Luis is suffering from diarrhea and needs to see a doctor, but Sandra and Luis's journey to the nearest medical center is anything but straightforward. Sandra has to get up at 4 in the morning and take a 2-hour bus ride into the city center. After she arrives at the clinic, she may have to wait in line for over 3 hours. This is the geographic barrier to healthcare. Once she reaches the front of the line, she'll have to communicate with the clinic employees in Spanish. Since Sandra is part of the indigenous population of Bolivia, her native language is Quechua, not Spanish, so she'll struggle to communicate with the health professionals. This is the linguistic barrier to healthcare. During the interaction with health professionals, Sandra and Luis are likely to face prejudice and mistreatment because of their social status as indigenous people. This is a result of decades of systemic discrimination against indigenous populations on the part of the Bolivian government and society. This is the historical barrier to healthcare. After her consultation, Sandra will realize that she may have to give up nearly a year's worth of income to pay for Luis's treatment. This is the financial barrier to healthcare. If we think back to why Luis got diarrhea in the first place, it's probably because in District 8, where Sandra and Luis live, basic necessities like toilets, showers, and clean running water simply don't exist. We plan to address these problems faced by thousands of families like Sandra's by constructing a community health center that will serve the over 50,000 residents of District 8, Cochabamba. This health center will address gaps in access to basic preventative health care and health education. Because we believe that community empowerment is the key to this project's sustainability, the health center will be managed primarily by the women of District 8. They will decide what services to offer, as well as how much to charge for premiums and service fees. They will receive constant support from Refresh Bolivia, as well as Redacción, a local NGO based in Cochabamba.
Se necesita hartas cosas, como por ejemplo un centro de salud.
Un centro de salud, sí, claro.
Sí.
Hay veces enfermamos, hay veces los niños estamos enfermos. No hay un centro de salud.
The health center will provide several services to promote health and community well-being. These include basic medical consultations, provision of sanitary products, bathrooms, a nursery, a community multipurpose room that can be rented out for events, a basic pharmacy, a shower, a kitchen, and a computer and printing room.
Yo creo que es de clínica.
De clínica.
Para aquí yo creo que nos puede ayudar a muchos.
Claro. ¿Ahorita tienen acceso a un hospital?
No tenemos aquí. No tenemos aquí.
¿Y si los niños se enferman?
A centro que vamos.
¿Es muy lejos?
Lejos que
Our health center will provide services that are more financially, geographically, and culturally accessible to the residents of District 8. As a result, usage of health services will become more frequent, and trust in biomedicine will increase, ultimately leading to improved health outcomes. Additionally, having a physical space encourages community empowerment by creating job opportunities, especially for women, and by providing a community meeting space, thus leading to increased social cohesion. Together, improved health outcomes and increased social cohesion lead to a higher standard of life. We are excited about the potential impact of this product and look forward to working with the residents of District 8 to realize our collective vision of community health. To learn more about our work, please visit refreshbolivia.com.